Hello, I'm Dr. Nazim here, and this picture, as you're seeing, is a CBC report, complete blood picture, and it is showing you different entities. So, I will tell you a bit about how to interpret the different cell counts as you see in a CBC. So, what sort of clinical information you can get from this report? So, the first thing that you usually see is WBC, which is the white cell count, or the TLC, total leukocyte count. So, it tells you whether the TLC is raised, normal, or low. TLC may be low if it is less than 5,000, and may be high if it is more than 10,000 in older children and adults. And for the neonates, we usually take up to 15,000 as normal. So less than 5,000 and more than 10,000 for older children, and more than 15,000 for neonates. And if it is less than 5,000, it can be due to any acute infections, like some acute bacterial infections, sepsis, some acute viral infections also cause a low TLC, like measles, like in viral hepatitis. Certain parasitic diseases like malaria, dengue fever also present with the same, with leukopenia in it. And if it is raised more than 10,000 or more than 15,000, so it also shows a raised level of infection, sepsis, and usually it is raised in any acute bacterial or viral infection. If it is much raised, like more than 40,000, more than 50,000, up to 1 lakh, so there may be a suspicion, it raises a suspicion of a malignancy like leukemias. Or if it is more than 30,000, more than 40,000, and you are correlating with the history, so it may be raised in whooping cough or pertussis. In immunodeficiencies, the TLC count is also gets low in patients who have inherited immunodeficiencies, or in HIV, who is having a full-blown immunodeficient state. So in that case, TLC count may be low. Lymphocyte count. So the lymphocyte count, the percentage is usually the 25 to 40%. So if the percentage is more than 40,000, more than 40%, it shows lymphocytosis, and it is usually raised in some viral infections, in certain bacterial infections like TB, and lymphocytosis may also be there in pertussis as well. So less than 25% shows lymphopenia, and lymphopenia is usually seen in some severe infections, immunodeficient states, if the person is on any immunodeficient drugs, or certain inherited immunodeficiencies also present with this lymphopenia. Then comes the neutrophils, or the granulocytes. So the normal percentage is about 50 to 75% of the total cells. So if it is more than 75%, it shows that there is neutrophilia. It is increased the neutrophil count, and also it gets raised in any acute bacterial infections. Then lymphocyte count, neutrophil count, I've already discussed to you. Neutropenia, if the cell count is less than 2.5, so what happens that this state is called as neutropenia, and it's seen in certain immunodeficiencies, and they may be because of certain drugs, and it may also occur in patients with leukemias and lymphomas, or who are on certain drugs which cause the neutropenia, and it is usually associated with a severe infection, and more aggressive treatment is required in such cases. Then comes the RBC count. The RBC count is normally it is between 4 to 5.5 to 10 raised to power 12. So if it is less than 4, it is usually seen in patients with iron deficiency anemia, or in patients who have some inherited reticulocytopenias, right? And then comes the HP. Also, RBC count is raised in certain hemolytic anemia like thalassemia, severe. Then comes the HB or hemoglobin levels, which are normally 12 to 16 or 13 to 15. So a low HB level indicates anemia. It does not shows you the cause of anemia. It just tell you that just a low HB, it is anemia. And if the HB is raised, it is usually seen in patients with polycythemia or in patients with hemoconcentration, the patients who have extravascular uh, fluid shift and there is hemoconcentration. So in such cases, you also may get a high HB. Hematocrit is the packed cell volume, and its normal range is, you can see, 36 to 52. If it is less than 36, so it is seen in anemia, and if it is more than 52, so it is usually seen in polycythemia. MCV is, you can see the normal levels to be about 78 to 96. So if the levels are, or if the MCV is less than 78, less than 76, it shows that the cell count is smaller, so it is usually seen in microcytic anemia, usually iron deficiency anemia. If the MCV is 78 to 96, so it is taken as normal. Normal levels of MCV are in normal children who do not have any disease, or in patients who have certain hemolytic diseases like thalassemia, like hereditary spherocytosis. So in all acute blood loss, all of this is usually associated with a normocytic anemia. A raised MCV is usually seen in patients who have vitamin B12 or folate deficiency or mixed deficiencies, or in patients who have certain infections like Diphyllobothrum latum. All of this is usually associated with macrocytosis, and it is also a type of anemia, macrocytic anemia or megaloblastic anemia. Then comes the MCH and MCHC, which is the mean corpuscular hemoglobin or mean corpuscular hemoglobin concentration. So it is usually decreased. It is less than 30 in iron deficiency anemia and is more than 35.5 in patients with hereditary spherocytosis. Then comes the red cell distribution width. Red cell distribution width is increased in iron deficiency anemia, whereas it is normal or low in thalassemia. So then comes the platelet count. So platelet count is, if it is less than 150, so it usually signifies thrombocytopenia. Less than 1 lakh with thrombocytopenia. If it is more than 150, more than 400, so it is usually seen in the iron deficiency anemia. The platelet levels may be low in certain hyperplating disorders like Lanzan thrombocythemia or Bernard-Soler syndrome or Wiskott-Aldrich syndrome, and certain infections like bacterial or viral infections, and parasitic infections like malaria, and certain infections like dengue fever. So in all of these cases, you may get a low platelet count. So platelet count is increased in patients with iron deficiency anemia. So it's more than 400 patients with iron deficiency anemia. Then comes up mean platelet volume. So mean platelet volume is also very important entity. Is the volume is more than 10.4. So it is usually associated with conditions in which the platelets are rapidly being produced because of the rapid destruction, like in case of severe infection, sepsis, uh, in cases like Bernard-Soler syndrome, and the volume may be low, less than 9.6 in patients who have certain inherited conditions like Wiskott-Aldrich syndrome or Glanzmann thrombocythemia. They usually have a smaller platelets. So this was some information, not all of that, but some of the information on CBC. So you can see this is a single report with so much information in it if you deeply analyze it. So do share if you want to know about any special topic, so we are going to make video over that. Stay tuned to the channel and subscribe the channel, so we will be there with another video tomorrow, inshallah. Thank you.